Hello everyone, welcome back to Radiology Made Easy, your all-time favorite YouTube channel. Let's see today's case. So, this is the image of today's case. First, go through it and come to your own diagnosis. Then we will continue with the case discussion.
Hi, welcome back everyone. This is case number 23 in RS series of radiology. Today our case is 3-year-old child presented with intermittent episodes of shortness of breath and cough for long duration. This is the frontal chest radiograph of scattered immature patient. So obviously you can see abnormality in the left hemisothorax. So there's loosened left hemithorax and there are no vascular markings in the lungs, so there's sparsity of vascular markings, oligemic, and there's mediastinal shift to the right side, trachea is shifted to the right side, heart is also shifted to the right side, and some kind of lung parenchyma you can see in the lower part. Right hemidiaphragm appears normal, no lesions in the right lung, however right lung is compressed due to mediastinal shift, no hilar masses, no mediastinal masses, no bilateral pleural effusions, and no base bone abnormalities. So in this case diagnosis is congenital lobe overinflation. Lobe overinflation. This is the diagnosis. Earlier it was called, previously it is known as congenital lobe emphysema. Now we call it congenital lobe overinflation. And the differential diagnosis, one is pneumothorax, tension pneumothorax. However, in pneumothorax you can see the collapsed lung medially, but here you don't see that kind of a thing medially, and also you won't see the part of normal lung parenchyma in the lower part. In the pneumothorax, the most of the whole lung will be collapsed towards middle line, and the one is we can get congenital pulmonary airway malformation, CPAM. Another one is, it also occurs in children. Another one which can occur in children is bronchial atresia. It's also a differential diagnosis. And in adult you can get a differential diagnosis is bulla due to emphysema, emphysematous bulla. So these are some differential diagnoses. When we talk about congenital lobe overinflation, it is more common in the left upper lobe, then the middle lobe, then right upper lobe. They are rare in lower lobes. Actually they are overinflated lobes. Lobes are overinflated and there will be sparsity of vascular markings in the lungs, and child will develop shortness of breath. And you have to differentiate it from pneumothorax, otherwise mistakenly people will put tubes to that side, then it will damage the lungs. And the next line of investigation is HRCT chest. You can do a HRCT chest. You can easily differentiate congenital lobe overinflation or congenital lobe emphysema from pneumothorax and other entities. So that concludes case number 23 in RS series. Please subscribe our YouTube channel, then you'll get notifications of our new videos, and also you can comment on our videos. Thank you everyone.
Thanks for watching. Please like and subscribe for more videos like this.